Good morning and thank you for joining us today. I would like to introduce Dr. Badar Zahir, a board-certified emergency medicine and family medicine physician. Dr. Zahir has 25 years of knowledge in emergency medicine and valuable experience in many emergency situations. He also conducts emergency drills at hospitals and airports. Many tragedies have been occurring throughout our nation, especially in schools and large gatherings, and most recently, the Highland Park shooting. We would like to take a moment to prepare the general public for unthinkable situations. Our goal is to prepare our community and hopefully save many lives.
So I know that you've had a lot of experience with like mass disasters and casualty type of events. Is there one particular case that kind of sticks out in your mind?
Yes, this is in 1999 when I was a resident doing some emergency medicine job in nearby hospitals near Kankakee. Probably it was St. Mary's Hospital. This tragic thing happened when a train accident happened. Because of the unplanned situation, this disaster happened. We could have reduced the casualties and fatality if we had planned it ahead of time. And with this lesson, I keep in mind that these emergencies do not plan ahead, but we have to plan ahead of time.
Sure. So can you tell me a little bit more about your experience setting up triage systems during a disaster?
This triage system is, we have a bag with tags. If somebody's dead, not breathing, we just put him like a black tag. And somebody who's a life-threatening situation that requires immediate attention, like CPR, cardiac compressions, anything, we give them a red tag so that this person needs immediate attention. And there's somebody yellow who can have a little bit of time to address the issues. And then green means they can go and walking around injuries. This can be handled by some medical staff or even non-medical staffs can help us in this disastrous situation. But red, obviously, the first-line responders like physicians, paramedics, everybody should do their job to save a life for red ones. And the green ones can stop. This triage system works wonderful because it will save a big disaster and also people rushing each other because somebody is dying and he's not breathing and you're paying attention who is just screaming. So this is the biggest system which can be very useful, very has been there for many centuries, I hope, and this is a life-saving system.
So what can an individual do when they witness a disaster?
Yeah. This is another question, like since I told you that we can save a life, saving life is our mission. If there's some event is plan ahead of time, a list of contacts in case these things happen. You have paramedics, you have transportation, you have the names of the hospitals nearby. You alert them before you plan, get the paramedics, the ambulance crew, stand by. So make a list, make a contact list, and also at the same time you can have as a design first aid kit. This is very useful. This is designed by me, and also it is for every medical person who is comfortable using these things. Like if you carry one pulse oximeter, which can give you a roughly idea of your pulse rate and oxygen saturation, which is a very great tool available nowadays. So also if you have somebody who's not breathing, you have ambu bag. You can start doing that pumping unless the ambulance arrives. So also you have you are carrying adult and children's airways. That will be also helpful to avoid the biting of tongue and obstructing the respirations. And you can carry one EpiPen. That's the life-saving thing that somebody has an anaphylactic reaction with the swelling of lips and tongue. not able to breathe, you give 0.2 ml of epinephrine, IM, 0.5 ml sub-Q. That will make a huge difference. You can save a life. If you are a nurse or you are a nurse practitioner, yes, you are a PA, you are a nurse practitioner, you can start IV fluids, normal saline sitting in your car, you can start it and save a life, because circulatory shock is another thing which we lose life. So these are all preventable injuries. And also, like physicians like us, we should carry one thoracostomy needle also. This is optional for you, but if you see somebody with pneumothorax, if you insert the tube and then life saved, hypotension is gone, patient is happy, you are happy. These are the simple things to save a life. You know, in military, you teach them how to insert a chest tube, so you can do this also in case there's a pneumothorax, but it needs little expertise. That's all. Thank you very much.
Interested in learning more about this case and learning more about Dr. Zahir. The book is called 101 Clinical Cases in the Emergency Room. This particular case was speaking about was a mass casualty event that occurred, and it's found in chapter 21. So if you'd like to learn more about some of the different experiences that Dr. Zahir's had in the emergency room and any different disaster events, this is a great resource.
Thank you very much.